Hi friends, today we are going to discuss about discharge of the patient under Mental Health Care Act of 2017. I am Dr. Suresh Bharatmat, Professor of Psychiatry, Head of Telemedicine Center and Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only. If you want to have a legal opinion, please do contact an advocate. This presentation is not a substitute for legal opinion. Conflict of interest? None. So, Mental Health Care Act of 2017 was passed on 7th April of 2017. So, the admission process for Mental Health Care Act occurs under two headings, that is under independent admission or supported admission. Independent admission is nothing but voluntary admission. Supported admission is nothing but involuntary admission. Regarding admission, I have made videos and please do visit my YouTube channel to watch those videos. Coming to discharge. Today's discussion is basically how the discharge of a person with mental illness from mental health establishment is done. There are two sections which is pertaining to it. Section 88, Discharge of Independent Patients. Section 98, that is discharge planning. Coming to section 88, when a person wants to take discharge, that is independent patient, form G will be filled by the patient and it will be handed over to the medical officer in charge. This is how this form will look, and these forms should be made available free of cost to persons with mental illness inside the mental health establishment. If the person is a child or a minor, the NR will fill the form H and will hand it over to the medical officer in charge for discharge. So if by chance with this, then the medical officer in charge will discharge the patient. However, by chance if the minor during the admission becomes adult from 17 he becomes 18, immediately the medical officer will shift the patient from section 87 to 86. That is independent admission and he is an adult. And as per his choice, the admission will continue. However, the mental health professional or a psychiatrist can prevent a discharge of a person with mental illness from the independent admission, and it can be kept for 24 hours for assessment. However, during this assessment, he has to observe that the person with mental illness who has been admitted independently has lost the mental capacity for treatment decision making. Then, one criteria, or else he has recently threatened or attempted or is threatening or attempting to cause bodily harm to himself. That is basically dangerous to self. Or recently behaved or is behaving violently towards others, or has caused or is causing another person to fear bodily harm from him. And in simple words, dangerous to others, or showing an inability to care for himself to a degree that places the individual at risk for himself. So these are the three important criteria should be there, along with loss of capacity. Then the person can be shifted to section 89. Or if the person has capacity and he wants to become under section 86 as an independent patient, he will continue to stay. But however, the discharge planning is very essential. And this section 98 will be applicable for all type of admission. What does section 98 says? Whenever a person undergoing treatment for mental illness in a mental health establishment is to be discharged into the community or to a different establishment, the psychiatrist who is responsible for his providing care shall consult with person with mental illness or with the NR or with the family member or a caregiver, and he will plan for discharge. And at the same time, psychiatrist will ensure that a plan is developed as how to treat him or services shall be provided with the person with mental illness after discharge in the community or in the other establishment. And the discharge planning under this section will apply for all type of admission under this under this legislation. To conclude, my dear friends, discharge of an independent patient occurs under Section 88. And if an independent patient is asking for a discharge, please do discharge them. But however, if you think they cannot be discharged, you can hold for 24 hours for assessment. And then you please act accordingly. Either you have to discharge or else shift them for Section 89 admission. By chance, all admissions are there for both independent admission and also supported admission. Section 98, discharge planning has to be done. And if you like this video, please do subscribe to my channel. This is my channel, youtube.com, C. Suresh Padadmat. Thank you very much. Stay safe.